It's time for Medical Moments with Covenant Healthcare, and today we're talking about what's new in the fight against breast cancer. With me today is Dr. Suzanne Bays, Medical Director of the Covenant Cancer Care Center. Thank you so much for being with us today.
Thank you for having me.
We appreciate it. So, Dr. Bays, you're a breast surgeon, so tell us about the latest surgical techniques in the fight against breast cancer.
It's actually quite an exciting time in treatment of breast cancer from a surgical standpoint. There are new techniques coming into practice all the time. We are especially able to blend the oncologic or the cancer treatment techniques in surgery with plastic surgery techniques, thus allowing us to be able to offer women surgical techniques that allow them to have their cancer fully removed, fully treated, but also leave them with an aesthetic look. It's very important that women feel whole at the completion of breast cancer treatment. We have always been able to offer certain types of reconstruction, but now we're able to offer women techniques while we can save their breast. So we remove the actual cancer, but reshape the breast, allow the woman to regain some of their self-image.
Yeah, and that's so important for women too. So there are also advances in genetic testing. Can you tell us about those?
About 10% of women who are diagnosed with breast cancer will be found to have a change in their gene that's passed on through their family. These are called inherited forms of breast cancer, and they are usually linked not only to breast cancer but also other forms of cancer such as ovarian cancer, colon cancer, pancreatic cancer. So we are able to offer these women testing, usually a blood test or a saliva, where we isolate the DNA and look for these changes in the genes. And these patients then have options of not only treatment of their breast cancer, but only preventative measures as far as other surgical procedures. For example, if they're at high risk for ovarian cancer, they might decide to have their ovaries removed. If they're at an unusually high risk of breast cancer, they could do preventative mastectomies to decrease their lifetime risk. This especially becomes important in younger women who we are trying to preserve their full life expectancy.
Yeah, that's just fascinating too. So what's the most important thing for viewers to know about breast cancer?
I think all the time, but especially in October, it's important for us to remember that early detection always gives us best results in treatment of breast cancer. So I would encourage all your viewers who are women over the age of 40 to go in for their mammograms, encourage their friends and family members to start their first screening mammogram at the age of 40 and continue it yearly thereafter, as long as their health and life expectancy is good enough to gain benefits from cancer treatment. Some of that their providers will be able to outline for them in more detail, but yearly, starting at age 40.
Very important. So why are you and the team at Covenant Healthcare so passionate about this work?
Breast cancer is, other than skin cancer, it's the most common cancer diagnosed amongst women. There are also men who are diagnosed with breast cancer. About 2,500 men a year in the U.S. are diagnosed with breast cancer, but it's also one of our most treatable cancers. And we at Covenant are here to not only provide early detection. We're here to see our patients through treatment, diagnosis, treatment, and then survivorship. And we have thousands of women in this area who are breast cancer survivors, and that's the best reward for the team, and we're happy that we're here to provide it.
Well, thank you so much for that, and as well as being with us today.
Thank you.
If you'd like any more information on today's topic, just head over to the Hot Links page on WNEM.com.